Hello, my name is Sarah Lovis, and today I'll be presenting on organizational culture in healthcare. This presentation will explore what organizational culture is, how it impacts nursing practice, and the role nurse leaders play in shaping culture, values, and innovation within healthcare organizations. What is organizational culture? Organizational culture refers to the shared values, beliefs, assumptions, and norms that influence how individuals behave within an organization. It shapes how employees interact, make decisions, and approach their daily responsibilities. In healthcare, organizational culture is especially important because it directly affects patient care, communication, and teamwork. A strong, positive culture promotes collaboration, accountability, and high quality care, while a weak or negative culture can lead to miscommunication, errors, and decreased staff morale. Key components of organizational culture. There are several key components that make up organizational culture. These include leadership style, communication patterns, shared values, policies and procedures, and the overall work environment. For example, leadership style can range from authoritarian to transformational, which significantly affects how staff feel supported. Communication may be open and collaborative or more hierarchical and restricted. Shared values such as patient-centered care and safety guide behavior, while policies ensure consistency. Together, these elements create the environment in which healthcare professionals work. Importance in healthcare. Organizational culture plays a critical role in the healthcare outcomes. A positive culture is associated with improved patient safety, better quality of care, and stronger teamwork. It also contributes to higher job satisfaction among nurses, which reduces turnover and burnout. Additionally, a strong safety culture helps minimize medical errors by encouraging open communication and reporting. Overall, organizational culture is a key factor in determining both patient outcomes and staff well-being. Organizational culture in the nursing practice. In nursing practice, organizational culture influences how nurses deliver care, interact with patients and colleagues. It affects clinical decision-making, accountability, and the use of evidence-based practices. A supportive culture encourages nurses to stay engaged, continue learning, and collaborate effectively. On the other hand, a negative culture can lead to burnout, poor communication, and decreased quality of care. Culture plays a major role in shaping the daily experience of the nurses. Impacts on nurse leaders and managers. Nurse leaders and managers play a vital role in establishing and maintaining organizational culture. They set expectations for behavior, model professional values, and create an environment that supports staff. Effective leaders promote teamwork, encourage open communication, and foster a culture of accountability. Their leadership style can significantly influence staff morale, retention, and overall performance. In many ways, leaders serve as the foundation of a positive organizational culture. Impact on staff nurses. Organizational culture directly impacts staff nurses in several ways. It affects their job satisfaction, stress levels, and overall well-being. A positive culture supports teamwork, effective communication, and professional growth. In contrast, a negative work environment can lead to burnout, dissatisfaction, and higher turnover rates. Ultimately, the culture of an organization influences how nurses perform their roles and the quality of care they provide to their patients. Alignment with vision and values. Alignment between an organization's vision and values and those of its leaders is essential for success. When leaders and staff share common goals, it promotes consistency in decision making and strengthens teamwork. The alignment also builds trust within the organization and ensures the patient care remains the top priority. When everyone is working toward the same mission, it leads to better coordination, improved outcomes, and a stronger organizational identity. Nurse leader influence on mission and vision. Nurse leaders play a key role in translating an organization's mission and vision into everyday practice. They guide staff in understanding and applying these principles in patient care. Leaders also drive change by promoting innovation, supporting quality improvement initiatives, and encouraging a culture of safety. Through their actions and decisions, nurse leaders help ensure the organizational goals are consistently met. Practice innovations in healthcare. Practice innovations are essential for improving healthcare delivery. These include implementing evidence-based practices, integrating new technologies such as electronic health records and telehealth, and promoting interdisciplinary collaboration. Organizational culture plays a significant role in how easily these innovations are adopted. A culture that supports learning and change encourages staff to embrace new practices, leading to better patient outcomes and more efficient care. Role performance and organizational impact. Role performance refers to how effectively healthcare professionals fulfill their role responsibilities. Strong performance contributes to improved patient outcomes, increased safety, and greater organizational success. A positive organizational culture supports high performance by promoting accountability, teamwork, and continuous improvement. When nurses feel supported and valued, they are more likely to perform at a higher level and contribute to the organization's overall goals. Limitations and utilization of resources. One of the key challenges in maintaining a positive organizational culture in healthcare is the limitation of available resources. Staffing shortage and high patient to nurse ratios can place significant strain on nurses, making it difficult to maintain quality care and a supported work environment. Budget constraints can also limit access to training programs, new technology, and professional development opportunities. Resistance to change is a common barrier, especially when implementing new practices or cultural improvements. Communication gaps between departments can further reduce efficiency and negatively impact teamwork. Time constraints also make it challenging for nurses to fully adopt evidence-based practices. Despite these limitations, effective utilization of available resources can help overcome many of these challenges. Strategies such as optimizing staffing through better scheduling and investing in leadership development and mentorship programs and leveraging technology like electronic health records can improve efficiency. Promoting interdisciplinary collaboration and encouraging continuous quality improvement initiatives also help maximize resources and strengthen organizational culture. Overall, while limitations exist, strategic resource management plays a critical role in supporting a positive and effective healthcare environment. Some key takeaways. Organizational culture is foundational element of healthcare that influences both patient outcomes and staff experiences. Nurse leaders play a critical role in shaping and maintaining this culture. When organizational values are aligned in leadership practices, it leads to improved performance, higher job satisfaction, and better patient care. Fostering innovation and strong role performance supports continuous improvement in healthcare organizations. A positive organizational culture is essential for delivering safe, effective, and high quality care. This slide includes all references used in this presentation.